Over the last 24 hours, we identified 228 new cases of COVID-19 and completed about 5,000 tests. On Saturday, we identified 253 new cases from about 6,600 tests, and on Friday, we identified 325 new cases and completed about 7,500 tests. There are currently active alerts or outbreaks in 154 schools. 7 of these schools have had 10 or more cases infectious in the school within the last 14 days. There are currently 432 people being treated for COVID-19 in hospital, including 77 in the ICU. Sadly, I must announce that 7 new deaths have been reported to Alberta Health since November 25th, ranging in age from 33 to 92. I extend my sympathies to the family and friends of these individuals and to anyone who has lost someone they loved, no matter the cause. We are closely monitoring new developments around the Omicron variant. My team and I are working with our public health colleagues across the country and around the world to understand more about this emerging variant and to keep an eye on its spread. At this time, there have been no cases of this variant detected in Alberta. However, as we have seen with other variants, it is very likely that Omicron will eventually reach our province. Our goal now is to delay the spread of Omicron until we learn more about it. I also want to remind all of us that while there are many unanswered questions about how the Omicron variant will behave, we know a lot more about COVID now than we did before. This knowledge means we are not going back to step 0.
Here in Alberta, 156 travelers have been identified who had returned in the past 2 weeks from one of the countries identified in Canada's enhanced border measures. These travelers were contacted over the weekend with information on current protocols, including testing and quarantine requirements. These travelers and their households have also been offered household rapid testing kits in addition to PCR tests. To be clear, no one has tested positive here, but we're working with these individuals to reduce any chance of spread. As a precaution, the following measures will be implemented for all COVID-19 cases identified in returning international travelers here in Alberta. Full case investigations and contact notification, PCR testing for all close contacts, and rapid testing for households in specific settings like schools and childcare settings. For all confirmed Omicron cases in people who did not travel, all close contacts will be investigated and asked about symptoms 14 days following exposure, and anyone with symptoms will be treated as a probable case. We believe that stopping this new variant at our borders is an essential first line of defense to prevent spread, so I am pleased that the federal government responded to Alberta's call to ban travel from the countries of concern and is now implementing enhanced measures for those who have recently been in the Southern Africa region.
I'm pleased to see that over 96% of AHS employees are now fully immunized and compliant with this policy, along with over 99.6% of physicians. I fully support AHS's decision to implement this policy, and my preference is to see all vaccine-eligible Albertans get immunized, especially those on the front lines of providing health care. However, there are some who have not done so, and this is a concern, especially in smaller communities where there's a potential loss of staff and an impact on patient care. The #1 priority must always be patient care and ensuring all Albertans, regardless of where they live, have access to the health services that they need. I do not want to see services in any community reduced because staff are unable to work. As such, I have directed AHS, as part of their staff immunization policy, to introduce rapid testing at locations where there is a significant risk of service disruption due to unvaccinated employees.
It is disappointing that about 3,000 of our staff have either not submitted proof of vaccination or have decided to remain unvaccinated. We have done all that we can do to encourage them. We've reached out to provide evidence-based reasons to get the vaccine and have worked hard to answer any questions or concerns that have been raised. And we have stressed just how valuable the vaccine is in protecting those in our care. Unfortunately, there are a small number of areas within our healthcare system where lack of vaccination may impact patient care, and this raises concerns for us all. That is why today, at the direction of the provincial government, we are informing our staff and physicians that AHS will temporarily introduce frequent targeted COVID-19 testing as part of the organization's mandatory immunization policy. The temporary testing option will be introduced at a small number of affected clinical work locations starting on December the 13th, 2021. The policy deadline for staff to be fully immunized will also be adjusted to December 13th to accommodate the introduction of this testing option.
We are looking at how to address the forthcoming holidays. As you know, one key trigger that I've articulated is getting our total ICU pressure below our baseline of about 173 beds. We've made good progress on that thanks to the diligence of Albertans. We are today at, I believe, just over 200 total ICU patients and about 70 with COVID. So we're now at 115% of ICU capacity. And the numbers have been trending in a positive direction. So if that continues, if we don't see alarming evidence about severe outcomes from Omicron, we will consider some kind of potential modest relaxation of gatherings, primarily because we are concerned about compliance. And, right now we've been asking people since the 4th of September not to gather indoors with more than 2 households, maximum 10 people. We thank folks who have carefully followed those rules. We want to make sure that the rules that are in place are rules that the majority of people will follow. So we're balancing all of these things out right now. We haven't made any decisions, but as long as ICU pressure continues to abate, we may be in a position to consider something as we move closer to the holidays.